Listen, a really, genuinely a warm welcome. London's sort of basking in mild February weather today, and great to see lots of you here for various people. Certainly in the UK, it's sort of half term this week, so I know some people will be missing or juggling different things, and then we've got people from all over the world, which is always wonderful. With Kath dialing in very early in the morning, and Nikki too across in New Zealand, and I can see Maureen there, and all sorts of others. Listen, big warm welcome, and particular warm welcome if it's your very first one of these. And I've slightly lost track. Maureen's going to help me on the counting. We're on something like 41, 42 consecutive sessions. If it's your first one, you're really, really welcome. Please do come and say hello in the chat. There's beautiful things go on in the chat, and all sorts of connecting goes on. But listen, we've got a wonderful team who are going to introduce themselves. So Hesham, with great thanks to you for rounding up a fantastic group of people to lead us through the next hour. Going to teach us a lot, share with us some things. I think hopefully get a bit of inspiration from everyone on this call. But to you and to Judy and to Steve and to the wider team, thank you so much. I'm going to pass things over. You're setting me a serious challenge on the tech, so I'm going to try and keep up to pace on that with all sorts of crazy breakout ideas. But listen, let's try it, see what happens. And why don't I pass over to you? So thanks so much.
Well, thanks. So hello, Steve McCann here. I get to start, and the way I'd like to start is just to start with the end in mind. So to give you a sense of direction and context, by the end of this section, what we believe is you'll have experienced how a subtle change in the questions you can ask can improve your results. So a really subtle change in the question can improve some of the outcomes you have in some specific conversations. And some of you, I hope, will choose to join us in running an experiment in your everyday lives that can help us look at a small change with a big impact. So more of that coming. And Judy, over to you.
So if it's okay with you, the way we'd like to do this is by setting things up for you to have an experience before we talk about it, before we give the explanation. We'll give you the minimum amount of explanation to get started and give you an experience. Is that okay with everybody? It's going to mean going into breakout rooms and talking to each other and actively participating. We do appreciate not everybody can necessarily participate, but the idea is this is experiential rather than chalk and talk. So here's what we're going to do. In a few moments, we're going to do an activity in breakout rooms. But in order to do that, you need to think first about some content that you're going to use in the activity. And the content we're going to use is we want you to think about some obstacles, some things that get in the way of understanding or feeling understood at work. And then we'll take those answers and we'll put you into breakouts to do an activity using clean language questions. Steve has put a brief, very super brief explanation of what clean language is in the chat. So those of you who just wanted that answer, 2-sentence, what is clean language, you can leave now, that's fine. The rest of you, please take a moment to write down, ideally 2 or 3 answers to this question. What is something that gets in the way of understanding or feeling understood at work? And examples might be things like, my boss won't listen to me, or we keep talking over each other in meetings, or there are far too many meetings and nothing ever gets done. Any of those kinds of things, whether they relate to your work in general, or your work with patients, or anything like that. This is not the place for the world's biggest problem, but it's also not the place for the most trivial problems in your working life. Anything just generally medium in between. Write them down and we'll use those in an activity in just a moment. So while everybody's writing, I'm going to just say out loud, clean language is not about not swearing. It's not even the same as clear language, speaking clearly, being clearly understood. It's different to that. It's a precision inquiry methodology, a way of finding out information and stuff from people and about people, what they mean, what they're really thinking, what's actually going on. And it's a set of questions that get the information you need more quickly, but at the same time ensuring that the person being asked feels heard and understood. Okay, has everybody got one or two things written down that get in the way of understanding or feeling understood at work? Is somebody willing to share one of their things? I'm going to pounce on people, by the way, and ask them to sing out loud. If you can't speak up or you don't want to, just wave. But it's even better if you use the raised hand feature, because then I can spot that you're ready to speak. So Karen, what's something you've got?
So I'm an academic, also a doctor, but in England, but I'm from the US, as you might detect from my accent. And I continue to struggle, 7 years in the UK, I continue to struggle to understand what people mean, because they use a lot of acronyms and shorthand. And it's not an English problem, it's just an acronym problem. And so I'll ask for clarification and they think I don't understand the bigger issue. And I'm like, no, I'm just asking, what does that actually stand for? And I go around and five times later and I still don't get it. I'm like, okay. And I'm like, do I feel too pushy? So I actually don't know how to get past that, but it happens all the time. That's why I bring it up. It's not going away.
Fantastic example. Thank you very much for that one. So all those TLAs, those 3-letter acronyms. Bimby, what about you? What's one example that you've got written down?
So hi everyone. I would say it's actually being on the same wavelength, and whatever you can do to be on the same wavelength. So there'll be a transmitter if you'd like, and there'll be a receiver of that information, and it's tuning in so you're on the same wavelength. So it's the context of the conversation as well as how it's being said, and looking to pick up on how it's being received to see whether that will be conveyed appropriately.
Thank you. So being on the same wavelength from Bimby, and all those acronyms from Karen. Great examples. Is everybody got at least something written down? In which case, I'm going to move on to set the activity while Bob sets up the breakout rooms. Here's the thing. What we're going to do is we're going to use one of the clean language questions. I'm going to write these instructions in the chat so you can see them as well. Just a second. So here's the deal. The first person reads out what they've written on their piece of paper. So, for example, all those acronyms. The questioner repeats back what they've just heard and then asks this question. And when all those acronyms, or whatever the person has said, what would you like to happen? Then you listen to the reply, and then you swap roles, questioner, questionee. And if there are 3 of you, swap round in a circle so that one person at a time gets a turn. And ideally, in this 5-minute chunk, you might get 2 goes each. And if there are 3 of you, the third person is the observer. When you're observing, notice what happens to the attention of the person being asked. Now, what we know from having done this activity many times is this question might seem a bit false, it might feel a bit artificial, but when you've used it for many times, you will find its value. In this activity, just try it out, go with it, play with it, and see what happens. Do stay. If you can't join the breakout rooms, it's only 5 minutes. We can we'll do something in the main room during the 5 minutes, and then we'll pick up again after the breakout activity. So do stay, even if you can't participate in the breakouts. Does that make sense as a set of instructions? Fred, are you asking a question about the instructions?
No, I'm sorry if that's still up. I'll take
Okay.
that down.
So I'm going to repeat the instructions in the chat. The first person reads one of the things they've written down. The questioner repeats the person's description of the problem and obstacle and then asks, and when, problem or obstacle, what would you like to happen? And if you can use their exact words, you get bonus points. So too many acronyms or not on the same wavelength, whatever they said. Bob, are we ready to go?
With you. Welcome back, everybody. Judy, back to you.
Thanks, everybody. Hope you had an interesting time in the breakout rooms. I got the general sense that everybody thought that was too short, even though it was longer than you were officially allowed, which is brilliant. I'm curious, what did you notice when that question was asked? Damara.
You know who I was on?
So I was going to say that I'm a trainer of motivational interviewing, and so I was hearing the change talk emerge, and I was doing the work. So the person that is asked that, what would you do next, has to actually do some of the work and think about what the next steps would be. So it moves the conversation forward.
Moves the conversation forward, and the person has to do the work. What kind of work?
Come up with the ideas and, think about how they're what the next step will be and what the future should look like to overcome the barrier.
Mm-hmm. Thank you. And Carolyn, what did you notice?
Our healthcare system.
I actually noticed more on the body language sense, Judy, that the person that I was working with immediately was looking up rather than looking at me, was looking up to show, engaged in what she was thinking, working it out.
Oh, Carolyn, could you just unmute
muted.
yourself, please? Something happened and you were suddenly muted.
Sorry, not sure what happened there. I'm not sure what part you got to, but
so
I noticed
we heard
more
you say
physical,
looking up.
Yeah, and so rather than actually sort of looking at me, she was focused much more on what she was actually thinking and working it out herself. But I noticed mainly sort of that body language cue of that she was really engaged with her own thoughts there as soon as I sort of asked that question.
So body language and really engaged with her own thought, and as Damara said, doing the work. Did anyone notice anything different that happened to the person's attention when this question was asked? Kath?
As an observer, I noticed that we had the luxury of the opportunity of the thing was spoken, and then two people could ask the question. And observing, I noticed a different response from in terms of what was fed back. And I heard one feedback to the problem said with some of the words, and then the second time the feedback of the problem was with more words, and the response from the person was different, like quite different in terms of what their reply was because of how they'd heard back their question.
So different. What kind of different?
Different in the way that the first time the response was about wanting to understand why the problem was the problem, and then the second time it was a different response in the context of the person fed back that they wanted to feel that they were allowed in. It felt a different place that they were coming from.
Thank you. Bimbi, what did you notice?
It's probably hard to vocalize this, but when the question or when the problem was reflected back with the added question at the end, what will you do about it? It suggested that there was a joint ownership of the problem, yet the person with the problem was in the driving seat, but felt comfortable talking about the strategies as to how to solve the problem that they presented or the challenge that presented. So almost tuned into the same wavelength, to use my phrase from earlier on, but it gave the sense that it was a collective, what are you going to do, or, reflecting the problem back to you, what would you like to happen, suggested that it just seemed to be moved to a joint problem, shared problem. That's how it felt anyway, from what I observed.
Thank you very much. So same wavelength and a shared problem, and it certainly made people think, and it changed, and it was different before and after. All of these things. Henrietta, thanks for putting your hand up. I'm afraid the time means that I have to move us on, but thank you for stepping up. Next time, I need to move us to Hesham, who has more to share.
Thanks, Judy. So I guess I wanted to share my experience of using clean language. So I first learnt about clean a language from Judy, actually, at a course about 10 years ago now, I think, Judy, commissioned by the Health Education West Midlands. And bearing in mind, I was kind of a consultant for about 2 or 3 years, and I have to say it was a big shock to the system when I realised that everything I thought I knew about how to communicate with my patients was probably wrong. So what really struck me with the language and that we've started to learn here in this session is how it completely transformed the power dynamics, just as Bimby was describing there. Typically, when I was trained as a medical student and even as an SHO registrar, the kind of questions I would often use as my kind of opening gambit in clinical consultations is the kind of questions that maybe some of you use, like, how can I help? And what I realized is actually by switching from, how can I help you today to what would you like to happen or have happen, suddenly change the power dynamics or put the patient, or in my case, the child and their family, in the driving seat in a way that I hadn't even anticipated was possible. And I've over the years have refined this a little bit more, and it was initially quite clunky, but now I've kind of established a pattern where I use that question and other clean language questions, which you'll learn about over the course of the session today, in a way that's really constructive for those consultations. And what has surprised me, and has been actually really kind of counterintuitive, I think, is actually by focusing on the process rather than the output that you want to achieve, suddenly that kind of idea of creativity and empowerment of the patient and their parents occurs in a way that I could never have anticipated. And an example of that was a consultation I had just last week with a young girl in my clinic who had asthma. And I took the history and, as I would normally do. And at the end of that consultation, I asked her and her 2 parents who were with me, what would you like to have happen? And initially they were like confused as to why I was asking a question like that. And I had to ask it a second or even a third time. And at this point that I also saw what Caroline mentioned, which is the eyes kind of rolling in the sockets as people started thinking, okay, well, actually what I would like to have happen is this and this. And then the parents had a slightly different perspective of what they would like to have happen. And that then brought a discussion, a 4-way discussion in the room as to what were the different agendas here. And we were able to kind of work it through in a way which definitely would not have been possible the way I used to do consultations, but essentially enabling that kind of clean slate. And as Dina said, that kind of motivation, that intrinsic motivation that was extracted through that consultation was really what was transformative. And for me, it was really satisfying, and it's been a great way of improving what I thought was okay consultation skills to great ones. And secondly, it's been a really, and this is a kind of the crucial point I want to end with really, is that it actually happens a lot quicker. And because you're extracting that intrinsic motivation, they can then run with those ideas that they themselves have created in that consultation in a way that I could never have manifested before. So yeah, I just wanted to share that personal experience, Judy, and hopefully that's something that we can build on over the rest of the session.
Thanks so much, Hesham. It's just so important to hear from real frontline clinicians who've used this for reality. It's not just a theory. So clean language in this context, what's it about? And for me, I was talking to somebody today about some training, and I said, look, you don't want the training, you want the result of the training. And you don't necessarily want clean language. What you want is the results it can get you. And it's about making people genuinely feel listened to and understood. It's just a form of words. It has a really big impact. And the experiment that we're going to ask you to join in later is about use it, see what happens. Because what we're looking for is there are many ways of developing relationships and empathy within the context that aren't necessarily about sort of using the traditional form of words. And we're not here to diss that form of words. We're here to say, you know, a slight shift might make a big difference. So it's fundamentally about getting to their content and making them feel listened to and understood. And we've spoken about the context of if problem, what would you like to have happen? And what we're going to shift towards talking about is using this to take histories, amongst other things. And that's the experiment that we're going to look at. So we're going to ask you to look at that, but that will come later. But for now, Siobhan, are you here? You have some experience of using clean language that had some very specific effects as well. If we've got you.
I'm here.
Hello, Siobhan, in you come.
Hello. So my name's Siobhan and I'm a specialist palliative care nurse, and I have been a palliative care nurse for over 20 years. And I only met Clean last year with Judy and Steve. And I was just asked to comment a little bit on one Jedi question that I played with that Judy gave us, which is what kind of. So Judy told us that we could say what kind of, so for example, what kind of pain might be a question that I use quite a lot in my world, talking about taking histories. And Judy said that you could ask that question up to 6 times or more. And it kind of blew my head, because I thought that if I asked the patient the same question up to 6 times, there was a possibility that that patient might think that I wasn't listening. Ironically, it's quite the opposite. I thought about it and I thought, if I took a history about a physical symptom like pain, I actively try not to assume or to give any words or to lead the conversation. So I probably do say what kind of pain and dig down. So I decided to take the challenge, and in my consultations, instead of trying to use clean language because I felt a bit clumsy with it, I just tried to use it on a trigger word. And that word was support, which comes up a lot in consultations and can mean a multitude of things. So if the patient said to me the word support, I automatically flipped into clean and I would say, what kind of support? And I would repeat that like Judy taught us, thinking it would feel clumsy. It doesn't feel clumsy. It is exactly what everyone has said this evening. You see an engagement, you see someone think, you see a total focus on what you said, and what you get back is not necessarily what you anticipate. Maybe it is what you anticipate, but what I would say is that it is, you get there quicker, and you get there quicker in such an authentic way that it actually builds a really strong therapeutic foundation. It doesn't feel like you're rushing the consultation in getting there quicker. It just feels incredibly effective. So, and in palliative care, I guess I chose the word support as well, because it comes up a lot, because people think they want support, but sometimes they don't even know what they mean by that word. It's quite hard to quantify. So actually, by using what kind of support, it actually helped them get to the answer themselves, or if they did know what it was, helped me be really clear what they meant by it. I hope that makes sense.
Oh, sure, that's brilliant. In your own words, I really appreciate that. So it feels authentic, it's quicker, and we can get to the content. And you will know from your own experience, when you feel listened to and understood in a busy world, it's amazing, because you know, I sometimes feel that miscommunication is the default in the world, because I know what I heard, I know what you meant. Well, I don't.
Yeah.
And this is a way, an easy way of sidestepping that. Judy.
So just briefly to say that a couple of people have said that clean language has been around for quite a number of years. It was created, not by me, by the way, by a guy called David Grove I wrote one of the popular books about it, co-authored a book called Clean Language, Revealing Metaphors and Opening Minds. But we reckon that within the NHS in the UK, just in the UK, several thousand people over the years have had at least some training in clean language in some circumstance, sometimes in a coaching context. Some people at blood and transplant in the Midlands, some people at a hospital in Walsall, different pockets of people have experimented with clean language. But what those of us who've come together to put this session together are aiming to do is reach maybe 1 million people within the health service and within healthcare worldwide with this idea of clean language, because we think it's a powerful adjunct to what you already do. And if, as Siobhan says, it can get there quicker and build a stronger therapeutic foundation, it's got to be worthwhile. It's also very straightforward to learn and to pick up. And let's do another breakout group activity. This time it's a bit more like you're used to doing at these sessions, groups of about 5. And our invitation is to just spend a few minutes chatting about how do these ideas resonate with you, and how might you help us on our mission to bring clean language to 1 million people? We'd love to know. Welcome back. Now I'm handing the talking ball to Steve.
I'm still recombobulating from being hooked and crooked. Elizabeth, I was enjoying listening to you. We can anybody else who was stopped. Right. So in the chat, Judy, are you going to put some stuff in the chat while I will put some stuff in. Talk here? It says here, debrief in plenary. Well, who would like to give us some thoughts about the great stuff they just spoke about? I'd love to hear what you think and how you might be able to help us going forward. Looking for hands. Oh, Bimby, hello. You're first up.
Oh, hi again. Sorry, I just put my hand up because I thought no one else was going to, so I don't want to hog. So apologies for that. But there's some great feedback in our room. One comment was that someone who's used appreciative inquiry and looked into this says that fundamentally this feels practically pragmatic with an earlier return, and feels simpler was the sort of sensation given. So that's quite a good insight as far as we were concerned from that. And we also had Kath, who shared her experience of using this, Kath Rooksby. And so she was asked about whether she uses this clean language from the outset in the conversation, or to rein it in and bring back when she feels it's going off track. And I think Kath's expression, she uses it when she can remember, but there's times where she tells herself off when she moves on from a conversation where perhaps she should have used it. And so that's just a couple of interesting insights from us, from our room. Thank you. Thanks,
Bimby. We don't come from a telling off place, and I think Hesham was going to say that sometimes he uses clean, sometimes he's cleanish. We're all about the effect. We're all about the return that you get, not about orthodoxy. So it's interesting. And Maureen, what thoughts do you have, Maureen?
Thanks. We had a fantastic session with people from Sweden and United States and England. And I think the thing I took away is we each have had different experiences that may cross over this a bit. Everybody felt like this added to our past experiences, but it struck me that maybe if we had sort of an asset map that linked all the different what matters to you, and working with palliative care with children, and looking at the education of physicians and nurses, there's so many different pieces going on. And I was just so impressed with how these potentially overlap and could support each other going forward. Wonderful group.
There is fantastic group strength there. Mary, we'll come on to you as last contribution before I time out. But yeah, motivational interviewing came in. We look at what's different and what's similar. and ultimately about what has the best effect. And I just hope some of you will be interested in running this experiment with us, because we are genuinely interested in finding out what actually works. It works for Hesham, it works for Siobhan. Could it work for you? Mary, what do you have?
So I had a question for you, or for the group around. So my understanding of it, as you've explained it, it feels very much more American than it is English. Naturally, you know, that kind of directness and that kind of lack of hesitancy around a particular issue. And I just wondered whether, in your experience, it was something that was a lot better done if you were in a different cultural context. So how does your cultural milieu impact on kind of your affinity, I suppose?
Mary, context has got a lot to do with it. My previous career prior to working with Judy and the team in Clean Language was in international humanitarian support, working in contexts all over the world. And I can say that Clean Language is simply the most contextually, culturally cross-functional method I've ever had, because it's about the other person, it's about respect, it's about empathy. I've never heard it called American before. I'm kind of looking at what we've said to you, because we tried to pack a lot into a really, really short period of time. There's a great deal more to it. It's ultimately really simple, but there's a lot more depth to it. I think it's culturally really cross-competent because it goes into metaphor, and that is the I'm being told to shut up. I've got to stop. There's a lot more to it. Judy, back to you.
I'm not telling you to stop. I'm just saying I've got things to want to add. Because I wanted to say out loud that David Grove, the creator of Clean Language, was a New Zealander. He did live in America for some years, but he was not American. The place where Clean Language is most widely used is in the UK, and it's caught on quite widely here. It's also used in quite a number of other languages. In particular, the Dutch seem to take to it well. There's a large Clean Language community in France. It's increasingly being used in German. There's a group of German people who've translated a bunch of the Clean Language books in the last couple of years and are finding it really effective, even though German is often thought of as being a language that doesn't lend itself to this kind of question, and yet they're finding it works once they realize why it's worth the bother. Does that answer the question, Mary?
Yes, and I didn't mean to offend anyone by saying it just felt a lot more, a lot less British, kind of, you know, kind of that.
No, it's a nice way of putting it. I didn't feel offended, and I would never be offended to be called a bit American. I got lots of good American friends. It's cool. Right,
Hisham's got his hand up.
Yeah, just a quick point, and maybe just response to Mary. I think what I have found is that it sometimes it is, when you first use it, people kind of look at you a little bit strangely and saying, what is it you just asked me? You know, what would I like to have happen? I thought you were the doctor. You were meant to tell me what was meant to be happening there. And sometimes you have to ask it a second or even a third time, or sometimes even I kind of just use cleanish language. So rather than, you know, how can I help you? I might ask, you know, what would help you achieve this, which isn't quite clean, but it gets them further along the way than they would have done with our kind of classical closed questions. So there's an adaptation there, I guess.
I think, Judy, are you closing? I think we're into just the bit where we ask you to use the resources, have a look at what you've heard, read. You can find us, you can join the Q Network. We'd love you to join the Q Network Clean community. We can't say anything else yet other than it's going to get more resourced, we hope, soon. Can't say any more. But yeah, join the Q Network, have those conversations, look at comparatives, look at the data sheet, and take part in the experiment. We'd love you to just use this and see what happens, like Siobhan has, like Hesham has. What I realized listening to Siobhan is she brought with her, and I said this to her for the first time, I just used one question. What's going on? I'm like, yeah, no, you didn't just use one question. You brought other stuff. You brought empathy, curiosity, and other stuff. And when you put that in with Clean Language, along with all your other skills, some pretty interesting stuff can happen. And that's what we're interested in.
Great, amazing. Judy, any final, we're hit time. Time for me to wrap up. Anything final you want to quickly come in on?
No, I'll just introduce Elmo. He stands for enough. Let's move on. We win an award if we finish on time.
Perfect. Listen, on that note, we try and be pretty strict on the hour because people have got so many things. Listen, huge thanks, Judy, Steve, Hesham, and to all of your wonderful colleagues, Siobhan, your fabulous words. Thanks to everybody who's joined on in. Two things to say. There's a wonderful question. Rich Frankel, I think, asked a great question about exploring and just sort of thinking about the link in through to kindness here. And for me, there's a real focus here on the behaviors that Judy, you got us practicing and doing and thinking about the way we speak, the way we listen. I think that links on beautifully to what's going to happen in a month's time. And my wonderful friend and colleague Susie's bottom right on my screen. Susie, come and say a really quick hello. You'll introduce it better than me. You've put a link in the chat. I put a link in the chat. Quick one for next time.
Yeah, hello everyone. Lovely to see you all this evening. Thanks for a great session. Next month, we are going to be joined by early career nurses and midwives who've been taking part in some research, basically capturing their lived experience of what it's like to join the workforce in the United Kingdom, so the National Health Service. And we're going to be hosted by two of my colleagues, Simon and Thara, who've been leading this research, and the research has been funded by the RCN Foundation. It's really powerful. I've put a link to it in the chat, but the invited guests will be hosting us, and I hope that you'll be able to join us. So in the meantime, if you want to have a look at any of the resources, they're there.
Great stuff. I'm feeling curious already, and we've got sort of sessions booked up for about the next 5-6 months, so please get in touch if you've got any other ideas. Thanks to everybody for your generosity and kindness in joining us. Look after yourselves, have a good month, and we'll look forward to seeing you in the middle of March. Take care now. Bye bye.
Thanks all.
Bye everyone.
Thank you.
Bye.